Welcome, Sinead, and over to you.
Thank you so much, Rosie, and to Ted for the introduction. I'm sorry that we missed enjoying your career as a rock legend, Ted, but it does mean that our paths have crossed in this way and we've been able to join forces for this evening. So some good has come out of that as well. So my name is Sinead. I'm Director of Development at RNID, and I'm going to kick off our presentation just sharing a little bit about hearing loss and about RNID strategy and role to tackle some of the issues impacted there. And then I'll head over to Alistair, who will give you some more detail from a kind of technology point of view as well. But Alistair is in the driving seat, so if I give you a look, that means next slide, please. Thank you. So we are RNID, which stands for the Royal National Institute for the Deaf. Bit of a mouthful, but we go by RNID. We are the national charity who supports the 18 million people in the UK who are deaf, have hearing loss or tinnitus. That's quite a wide group of people. So we have we support people who are deaf and have really acute hearing loss. So they might, for example, be BSL first language users. And we support people who have hearing loss, who might be able to lip read and do other things to mean that they can cope in social situations and might use a hearing aid, right the way through to people who have tinnitus as well, which can be noise, ringing. It can appear differently for different people, but a sound only you can hear in your ear. And our role is to support all of those wide community in a number of different ways, which I'll come on to in a minute. Our mission is to end the discrimination faced by our communities and to help people hear better now and fund world-class research to restore hearing and to silence tinnitus. So I'm going to start with a few facts and stats, because I always find when I meet people for the first time and tell them who I work for and what I do, they tend to be quite shocked by the prevalence of hearing loss. So I've already mentioned that there are 18 million people in the UK who fall into this category. People lose their hearing for different reasons and different ways, but mostly it's age-related hearing loss. So it's overexposure to loud noises without the right sort of hearing protection can over time impact your hearing. So unsurprisingly, that increases with demographics as people get older. So more than 50% of people who are 55 and over will have hearing loss, and more than 80% people who are 75 and over will have hearing loss. So we're talking about a huge proportion of our communities and of the population, making our role really, really quite critical. And of those, 1.2 million have really acute hearing loss. So that means that they can't hear conversation or speech. If you imagine that in a virtual setting such as this, or in some of your day-to-day life around the dinner table, ordering a coffee from a cafe, these are the kind of everyday experiences and barriers that people face who aren't able to communicate in the way that you might expect. Alistair. So this is where we come in. Now, I'll start by saying we are a national charity and we are the largest charity that works in this area. We are a staff of about 140 people. And I don't know if you know anything about charitable organisations, but we're really quite small. And we rely heavily on working in partnership with organisations like this one and others to mean that we can really deliver our strategy. We have a really bold ambition and we want to change the world for our communities. And we do it in three main ways, or have started to do it in three main ways. So the first one is about changing society and public attitudes. So this is thinking about the broad spectrum of the general public. We want everybody in the UK to understand why it's important to check their hearing, how to check their hearing, and to do it regularly in the way that you might do checking your eyes with the optician, checking your teeth with the dentist. We want this to become really commonplace. And we want people of all ages, young right the way through, to know how to protect their hearing from loud noises and think of it as a kind of normal thing to do. So rather than there be a stigma around using hearing protection at a gig, we want people to just do it as part of their normal lives. And we want to create a kind of step change that means that people are included and involved in everyday life, even if they have hearing loss. So that's the kind of big society piece. And then the next piece that we focus on is around changing systems and services. So we want to make sure that there are effective treatments and cures for hearing loss and to silence tinnitus. At the moment, there is no cure and there are no effective treatments, and we're working really, really hard to change that. We also want to make sure that employers are looking after their staff in the best possible way. So thinking about your organisation and the people that you work with 1 in 3 adults having hearing loss, actually the chances are you will be working with people who have hearing loss and often their needs aren't met. So we want to help to remove some of those barriers and mean that people are really valued, and we can put the right things in place so that they can really thrive professionally. And I won't say too much about technology piece because Alistair will come on to that in a minute, but it's a really key part of our strategy that we think about how technology can play a role and that our communities are involved at the right point and know what's possible for them and what sorts of technologies can help change their everyday life. And then finally, we talk about changing lives one by one. So we've talked about kind of mass awareness, changing the whole of society, but also we're here for you as an individual. So we have volunteer-led community services. So you can go to one of our RNID near yous and get your hearing checked. You can get information about hearing loss and be really well supported there. And also have your hearing aid cleaned and maintained, which a lot of people don't know how to do. And we have online and phone services as well. So we're there whether you are part of an organisation who wants to do some of this stuff better, or whether you as an individual or family or friends need some kind of hands-on personal support. And then the last thing from me, I just wanted to pick up particularly on healthcare, which Alistair will come into in more detail in a moment. We work really hard to make sure that hearing health is on the national agenda, working with and influencing policymakers and the NHS. We want checking your hearing to become as normal as checking other parts of your body and your senses. So particularly looking at ophthalmology and dentistry and how the stigma isn't there for people to check and to look after themselves in that way. And to make sure that the actual audiology services are really fit for purpose, so they're giving people what they need in order to get the support and healthcare that they need. And with hearing loss, the barrier to good healthcare isn't just about hearing loss. So if you can't hear properly or have your communication needs met, that is just as much of an issue if you're meeting an audiologist as it is if you're meeting an oncologist, say. And we've heard some really shocking stories of people who've needed to rely on friends and family to translate for them in these circumstances, or indeed have had a consultation or a meeting with a healthcare professional and left not knowing how that consultation went because their communications needs weren't met. So for us, this is a massive priority, but also the opportunities to do so much better are really there. So I'll pause there, and Alistair, I will hand over to you and let Rosie do her magic of spotlighting you as well.
Thank you, Sinead. I think I am spotlighted. Can I get a little nod? Yep, excellent.
You
lovely.
are indeed.
And I've managed to unmute myself. So the 2 most important technical hurdles have been overcome, which is great. And yeah, it's lovely to see in the people who joined us a few familiar faces and also lots of people who I don't know. So welcome. Thank you for giving up some of your Tuesday evening to come and listen to this. The rest of this talk is structured around a report that we put out at the back end of last year. Full credit to Lola, the programme lead, who had done this work, for putting these slides together. We heard that you are technology savvy group of people, and so that you wanted to be able to dig into the tech. So I'm going to run you through the report and try and highlight and expand on the bits that really focus on the technology, which is where hopefully some of the interest particularly lies. You might notice, as with all things in life just now, that AI features a little bit. I also heard that you quite like interactivity. So If you want to play some AI bingo, then anytime I mention the word AI, then feel free to make some sort of reaction or make a note of it, and we'll see who notices the most incidences of AI over the course of the talk. So just a little bit of background to me. So I have a background in engineering, so electronic engineering with music technology systems as a first degree, then a PhD in binaural hearing or binaural technology, which is how we hear where sounds come from. And the brain is a phenomenally advanced processor of sound and can do all sorts of really clever stuff. Acoustic signal processing, which is what I really specialize in, is how we try and get computers and microphones and machines to replicate or mimic some of these behaviors, and also work together with the human brain to pick out sounds that you particularly want to listen to. So I spent about 10 years at Imperial College doing postdoctoral research, developing algorithms that made robots and hearing aids kind of understand the world around them. And it was great. I enjoyed it a lot. But what I noticed was that we can make the technology better and better and better, but there's a disconnect between what we can do in the lab and what people are actually using in their everyday lives. And so when the opportunity came up to join RNID and actually try and help sort of affect some system change and get some technology into people's hands and into their ears, it was a great opportunity, and it's working on projects like this that really make it all worthwhile. So without further ado, let's crack on into why hearing health matters. Well, Sinead has already mentioned that there are 18 million people in the UK who are deaf, have hearing loss or tinnitus. And this is an issue because we know that unaddressed hearing loss leads to all sorts of problems, particularly to do with people being excluded from everyday life, from lots of things that are important to them. And I don't know about you, but I certainly know people who this has affected individually. And we want to be able to help people make that step from having unaddressed hearing loss to taking steps to address it. And there are lots of things that go along in the process, from noticing that you have hearing loss to getting some help with that hearing loss to really thriving with hearing aids, which is normally the kind of treatment or solution for that. And so this work is really all about how do we help people along that journey. So this work has taken a long time to come to this point, and the reason for that is because everything has been grounded in the communities that we support. This timeline shows in spring 2024 a report that was published about people's experience of audiology services, and that was the stepping off point for us to then go out and actually look at, well, how can we address the problems that people encounter accessing these services and then going on with their hearing aids. So we've spoken to lots of stakeholders across all different sectors. We've looked at what technology is out there now and what technology might be coming on the horizon. This has led to all sorts of really quite detailed interviews with different experts to try and put together a vision for what hearing healthcare might look like in the future. And then those ideas were tested in a patient survey so that we could be sure that the things that we are proposing are things that people want and will genuinely benefit from. So we're now in the stage where we've published blogs about various different ideas, and we're really looking to ramp up on the doing part of this, and are seeking various partnerships and pilot opportunities so that we can put these ideas into practice. So the challenge really here is that we know that NHS is struggling to meet the current and expected growing need as the population ages. So really the question is, how can we get free hearing healthcare delivered to people in a way that's accessible to them? And we have really broken this down into 4 particular areas of opportunity. So the first is being able to identify early signs of hearing loss. Being aware that your hearing maybe isn't as good as it used to be is the first step to this, getting on this journey to addressing hearing loss. The second step is getting a proper diagnosis, followed by getting the support that people need, and then getting on and living with hearing loss with their devices. Throughout all of this, we've been working with all sorts of people, healthcare professionals, academics, technology professionals, and people with lived experience to make sure that the ideas that we put forward are really sort of grounded in people's needs and wants. So, taking each of these areas in turn. The first thing that we need to improve, or think there's potential to improve, is how we detect hearing loss at the earliest possible stage. There's three areas on the screen here: digital hearing checks, NHS service directories, and AI-based ecological hearing assessments. So these are color-coded to give some indication of where we are with these things. Things that are with the very, very light blue background are things which already exist and just need to be scaled. Things which are in a darker blue background are things which exist maybe in other areas of healthcare, but need to be translated or expanded into hearing health. And then things in the dark blue are the bit more futuristic ideas, things which we need to do some work to get them validated in a healthcare setting. So digital hearing checks have been around for a while, and if you go to our website, you will see that we have one that you can try for yourself. The point of a hearing check isn't to say you have hearing loss. It's what we call a behavior change tool. It's designed to give you enough information for you to say, I think I need to get my hearing tested properly. And we can already do it online, but what we need is for people to be doing this as a regular part of their everyday life. It only takes about 3 minutes to do, so it's not difficult. And so the question is, how do we get this embedded into people's lives? This could be part of NHS routine screening, or it could be through other ways that people are prompted to do those checks. The point is that the technology exists, it just needs to be scaled. If you decide that you need to get a health check and you go to the NHS website, you can type in find a GP and you will be given a list of GPs in your area. Similarly, if you need a dentist, you can type in find a dentist and it'll give you a list. There is no service which lets you find an audiologist. The route into audiology care is different depending on where you live, and there's no easy way to access it. So we think that an NHS service directory would really help to people to find and access that first point of where can I go to get my hearing checked. And finally, the technology heavy thing is a thing that we've called AI-based ecological hearing assessments, which first of all needs improvement on terms of the marketing of what we call it. But this is really about taking advantage of the technology that already exists in current earbud type devices or hearables. There are lots of sensors that are available. They have microphones in them. They have a thing called inertial measurement units, which are able to detect the motion of your head. So these are currently being used to do things like to spatialize audio, so that when you turn your head, sounds appear to come from different directions. But we also know that the natural thing to do in everyday life is that when you hear a sound, you turn to face it. That's just the way that the brain works, is the ears drive the eyes. So if somebody is not turning to face sounds in their environment, then that could be used as a cue that perhaps they're not hearing as well as other people. So then could you say, well, if your device can detect that you have some hearing loss, can it prompt you to have your hearing checked? So we've detected that we think there may be some potential hearing loss. The next step in the journey is to get a proper diagnosis. Now, there are various stages that you might go through in a referral process for a hearing test. And the first thing is that you need to have your ear checked. It's possible that your hearing is affected because you've got wax in your ear, or it might be that you've got an ear infection. And the first thing that someone's going to do is to look in your ear and see what's going on. We now have video otoscopes, devices which can record pictures or videos of the inside of your ear. We think the use of these could be scaled so that people can have their ears looked at or examined in lots of more places than they can right now, which would help to triage and would help to make sure that people are being sent to the right place. Because there's nothing worse than being referred to one profession and then being told, actually, no, your problem is something else, and having to be referred somewhere else. This can all be supported using better use of NHS apps, which would help people to know where they need to go, and automation and AI in the triaging of how people access these services and the referral pathways. Moving on to the more tech-heavy thing is that remote hearing tests are now becoming possible. So traditionally, you would go into a clinic, into a soundproof booth, and you would listen to different tones being played to you, and you'd respond to when you can hear them. It's now possible to do that using technology in your own home or in a primary care setting. The benefit of being able to do it yourself is that you can do it at a time that's convenient to you. And we know that the easier it is to access these kinds of services, the more likely people are to do it, and the quicker they'll do it. We know of one brand of hearing earbud that now has a clinically validated hearing test. It's perfectly feasible that others could follow. And being able to use the data from that kind of test to get yourself a referral could be really helpful. So how do we actually get hearing aids to people? This is, it's a difficult question. There are bottlenecks in services, and the time of audiologists is precious. So the more ways we can find to make it easier to get access to devices and to appointments, the better. So one way that we can make it easier to get more people through audiology is to be able to remotely adjust them, potentially to fit them remotely and then to adjust them remotely. This feature is something that already exists in some hearing aids, but it is not routinely used in the NHS or not routinely offered to people. With these kind of features, some people want them, some people don't, and we are certainly not suggesting that everyone should be forced down this route, but the ability to have something adjusted remotely means that you don't have to book time off work. You can get things done more quickly, which again just means people are going to do better with their devices. Another area, kind of technology, which would help make it easy to access healthcare are things like speech to text. We know that people can struggle to communicate, and so if you can use these accessibility features to aid that communication process, then it makes the appointment go more smoothly. We also, it's starting to be possible now to capture an appointment with a healthcare professional and turn that into meeting notes or consultation notes, that then using AI to then document what's happened in the meeting or in the consultation, which means the clinician can spend more time actually talking to the patient, which means they can spend more time listening. They can spend more time understanding the actual needs of that individual and making sure that they set up the devices with the features that they need. And again, NHS platforms can help to make sure that people are accessing the right services and getting access to the technologies that are going to really help them. But yeah, make the most of what's available. One sort of technology or feature that has been trialed in some areas is guided decision-making tools, where people are able to work through a simple set of questions, which helps them to work out what solutions are right for them. And finally, we are interested in how we can help use technology to help empower people. The one at the top, AI-enabled hearing aids, is a bit of a catch-all. There are so many things that hearing aids can do that benefit from modern signal processing. The ability to cut down background noise using deep neural networks is the sort of latest thing, which some hearing aids now have, and which is promising to be revolutionary. There are also things which are in use but can always get better, to do with understanding what environment is the user in right now and adapting the processing according to the context and what the user is trying to do in that space. Something else which anyone who may have seen me on LinkedIn will know I'm a big fan of is Auracast. So wireless connectivity is key to people getting the best from their devices, and the ability to stream audio directly to your hearing aid in either from your computer or in public spaces from a sound system means that people can hear much more clearly. We had a user testing experiment recently at Bristol Temple Mead Station, where they have installed an Auracast system, and the reaction of people being able to hear announcements for the first time was really incredible, and enables people to do more with their life because they are empowered and confident to travel independently. Again, we have NHS apps and platforms. At all points in this journey, the ability to access digital technologies to support someone through that journey and to work out what needs to happen next. How can we make this experience better? It can help at all stages. There's also something around the more that we can have apps and services collect data to understand the way people are using their devices, the more that we can understand and develop devices which do a better job of meeting that person's needs. And finally, in-ear biometric monitoring. It turns out the ear is actually a really good place to do all sorts of monitoring of your bodily functions. So you can monitor sleep, you can monitor steps, you can monitor heart rate, which means we can understand a lot about someone based on in-ear sensing. So as well as understanding their hearing, we can understand, well, are they getting stressed? Yeah, the sort of different things which might be affecting their quality of life. I mean, can we check, well, are they even moving much? Are they getting out of the house? Or are they kind of being quite sedate in their lifestyle? The more that we can help people to be active and get out and meet people, the more that we can know that their sort of well-being is being addressed as well as their hearing. So to summarize, there are these 4 key opportunities for using technology to transform hearing healthcare. Making sure that people can detect hearing loss early, they can get a quick diagnosis, they can get access to the devices they need, and they can be supported in managing their hearing health into the future. We think there's opportunities in all 4 areas, and if you want to find out more, you can get in touch with the project team that you can see on the screen just now. I've gone through that all pretty quickly. I'm hoping that means we can spend a lot of time having questions and digging into the technology a bit more.